Hi everyone, welcome to Unit 2, where we're going to be talking about integrating counseling roots with evidence-based practices in counseling. So here's the big question we're going to go ahead and be looking at this week. Can the core essence and intuitive wisdom of traditional counseling theories be truly harmonized with the empirical rigor and methodological demands of modern evidence-based practice? Woo! What a mouthful, right? But that's what we're going to go ahead and be thinking about. And I want to give you some information that will go ahead and help you think about that. So let's start with Carl Rogers. And I just love this quote. The curious paradox is that when I accept myself just as I am, then I can change. Just makes my heart melt. So good. And the question I have for you all, is that enough? Truly, is that enough? I know that when we teach counselors in training, there's a lot of catchphrases that we like to use. Make sure to trust the process. Make sure just to sit with clients. Empathy can be enough. But my question to you all, and I want you to think about this, is that truly enough? So first, I want to really talk about the foundational theories that are really drove into us as professional counselors, because before there were randomized control trials, counseling was rooted in theories like maybe psychodynamic, but really Rogers' humanism. And Rogers, and I would say our fields, really adopted this idea from going away from diagnosing to empathy and listening. And if we go into the literature and we look at some of the wellness models that we pull off of, counseling developed in contrast to the medical model. So when we think about evidence-based practice and we think about us becoming a part of the healthcare profession, it seems like we're moving a little bit more towards that medical model to get legitimacy, but we have to recognize that the reason we as professional counselors sometimes struggle with evidence-based practice is because we came out of a counter narrative to that. So we also have to be mindful that our historical roots, like we talked about before, is in strength-based, not pathologizing people. And counseling emerged from human development and guidance, not necessarily psychiatry. And that created early tensions. It created early tensions. So we need to think about why we as professional counselors sometimes are behind in evidence-based practice. And we want to think about holding two things at the same time. That's why I asked this big question. I think we have such a cool thing to offer the mental health field. And is there a way we can bring that identity into evidence-based practice? So things like core values like empathy, authenticity, and unconditional positive regard are, I would say, the lifeblood of counseling. And historically, we resisted a standardized one-size-fits-all training or treatments. And training often fails to integrate research with relational counseling approaches. One thing I do want to say is that there is this tension between integrating research with relational counseling approaches. When I teach practicum, I hear from folks that are not professional counselors, wow, your students are so good at building relationships. And they safeguard that relationship to the point that sometimes I'm not sure folks are doing work. And that's just something for all of us to think about as professional counselors as we train folks. Other values that are core to us are culture and identity, and these aren't optional in therapy because they're so important to helping clients. And it's not that we are anti-research. It's just that we fear sometimes that engaging in evidence-based practice may strip away the heart of therapy. So just some last thoughts here. One of the scholars in one of the articles I am providing you all said this: that this scholar observed that professional training hasn't always modeled how to integrate scientific rigor with counseling's relational essence, which leaves many counselors hesitant about evidence-based practice. So my question to you all is, first, how can you really understand and learn evidence-based practice? And then how can we take that identity of being a professional counselor and bring it into it? You all are going to be leading the field as counseling educators. What is evidence-based practice? So one thing I want to go ahead and highlight is I try to go onto the American Counseling Association's website. Now, maybe you all go onto it, but I need to say that when I went onto it, I didn't find a definition of evidence-based practice. So I want you all to think about this for a second. If we're trying to become more legitimate within the healthcare profession, and we want to prove that our approach around focusing on wellness and prevention and that the relationship matters, don't we need to go ahead and get on board with evidence-based practice? Part of why we struggle to gain legitimacy within the field. So we need to go to the American Psychological Association for a definition of evidence-based practice. And they define this as the integration of the best available research with clinical expertise in the context of patient characteristics, culture, and preferences. And this definition is accepted across different mental health disciplines, including counseling. I just want to end with this. I do think as a field, we need to go ahead and create our own definition of evidence-based practice. In your discussion, you provide that definition. Let's talk a little bit about why the struggle. So why professional counselors and K-CREP programs struggle with evidence-based practice. I first want to go ahead and thank these authors. If you Google this, barriers to evidence-based counseling practice, a counselor educator training model, you'll be able to pull it up. And I'm kind of lecturing off of their points here because they really summarize this well. A couple things to think about. Why we as professional counselors will sometimes struggle with this is a lot of our students and also some of our counseling educators lack the skills in evaluating and applying research, right? Now, and some of you might disagree with this, us counseling educators love qualitative research. I do too. And I think listening to the lived and told stories of the folks we're trying to serve are important. And I think putting that aside, randomized control samples is important. Now, I did a study where I looked at the lived and told stories of a certain population, and I interviewed 5 people. Do I think that there is value in that? Do I think that can inform practice? Yes. Do I think I can make broad claims based upon interviewing those 5 people? Absolutely not, right? So this is where some in other fields might even criticize the study I've done. And I think that still has value, but we need to recognize that's just informing. We can't make broad claims based upon that. So there's weak research and practice link, and there is time and resource barriers because clinicians face heavy caseloads, and there isn't really money, necessarily reimbursement, to engage in research. There's also identity confusion amongst us as professional counselors, even though we've already lectured on that and us as counseling educators are trying to instill that in our students. If you go into the field, it's all over the place. There's patchy curriculum integrations. Again, we as a field haven't really come around a definition of what evidence-based practice is and what it is not. I think what we do in counseling education is we like certain things and then we go try to prove that it's evidence-based by finding different things, and that's just not going to work. And some of the traditional cultural and developmental models might clash with evidence-based practice norms, such as being able to really articulate what the approach is, the interventions that go into it. really clash with that trust the process, feel the relationship, and go where the client wants to go. So you just want to think about all that. So just want to highlight some other points. There's limited research training. You as counseling educators will see that in our students. They're like, oh, I don't want to take the research course. Ugh. And that affects it, right? Also, counseling educators, us, the gatekeepers of the field, also report concerns about incorporating it into the curriculum. There's barriers in practice settings in terms of it may conflict with the agency or what they're doing or what they're marketing. Culture and engagement, where organizations support evidence-based practice and educational growth. Actually, a study was done, you can go look at that one scholar. Counselors report higher work engagement. And you're seeing that in some of the tech companies. We can go ahead and criticize what they're doing, and they have pretty high engagement scores amongst their professional counselors or their therapists because they know what they're being evaluated on, what's success, and they all help with that. So, lastly, professional identity, like I said, is a struggle because we know what it is as counseling educators, but it's across the board once we're in the field. And KCRAFT is trying to, they standardize training by driving to certain competencies or standards. But like how we all do that is so different. And there isn't really a great checks and balance to that. So in summary, I want us all to think about those barriers. How can we as counseling educators start to think about maybe how we've negatively contributed to the anti-evidence-based practice movement and how we can better help with all that. Let's go into what is evidence-based psychotherapy. Evidence-based psychotherapy, I want to highlight what are some of the approaches I want you all to be thinking about. And I'm pulling this off of the American Counseling Association because unfortunately we aren't as on top of this as we should be, and who. The other thing too is I want to share a quick story. When I was in my PhD program, I had faculty criticizing CBT. I was also one of those people, right? I was also one of those people criticizing it. Unfortunately, if once you get a PhD and you're really reading a lot of literature and you're really buying in that evidence matters, you start to think about, wait a second, this thing that we keep on hating on, it's like a club to be a part of, actually really works. Why are we hating on this thing that really works? And again, I think it's because we're in this all or nothing thinking. Like we can't be relational and preventative and focus on wellness if we're doing CBT. But I just don't think that necessarily is the truth. We need to keep in mind that still to this day, CBT and other related therapies are probably some of the more evidence-based things out there. That's just where the evidence is. And there's some therapies out there that are ineffective. Things like conversion therapy. And in Colorado, there's a lawsuit right now stating that folks should be able to do that because of their religious tradition. So this is why, as professional counselors, we need to get on board with evidence-based practice so that we can also really push back against some of those harmful approaches. So CBT, I would say, is the foundation to evidence-based practice. And if we look at certain diagnoses like depression, anxiety, OCD, CBT is the gold standard. And there's a lot of moderate to large effect sizes and control studies specifically on CBT. There's also third wave approaches that connect to those principles that are a little different. So ACT is equal to CBT for anxiety, depression, certain addiction. Mindfulness-based cognitive behavioral prevents relapse and recurrent depression. And I do think approaches like DBT has brought mindfulness into it, and there's some good results to that. We need to keep in mind that as professional counselors, I would say we're not the best at recognizing personality disorders, and that can be a problem because things like borderline personality disorder, there are some gold standards out there that can really help people live that life worth living. Some trauma focused therapies, again, EMDR, I know that can be a little controversial, but the evidence for EMDR is there. And PE, prolonged exposure therapy, is also evidence-based with trauma informed. However, we're not really teaching PE in our counseling education programs, are we? No. And that's an evidence-based thing specifically for trauma. When we look at things like OCD, we look at ERP, exposure and response prevention, which is a type of cognitive behavioral therapy specifically designed to treat OCD and other anxiety disorders. But again, are students being exposed to these? Because there's large effect samples on this, sometimes can outperform SSRIs, right? And can help prevent folks struggling. There's some other ones out there that we shouldn't get freaked out if students are using, like interpersonal therapy, strong for depression, really using your own relationship in the here and now and the dynamics within the room. Family-based therapy, couples therapy, short-term psychodynamic therapy is making a comeback, and there's some scholars really doing some cool stuff with randomized controlled trials specifically to that. So I'd say we don't need to freak out about those right now, but we do need to think about here are some of the best therapies if we're looking at certain diagnoses. Now, again, I view diagnosis is not as an identity, but as language to name a phenomenon. And if we name that phenomenon, we can access the different things that can help. And I went over all these already. So you're going to see different counselors in training being drawn to different things. Right now, I'm seeing folks being really drawn to IFS. And what is it? It's parts. It's inner critic, wounded child, a protector aimed at healing internal conflict people have. I actually thought it was had to do with your own family, but it wasn't. Why is it popular? It can be intuitive and emphasizes self-compassion. And, right, although there's some promising things coming out about it, there haven't been large randomized control trials, and we're not finding in guidelines. So while it might not be harmful, it's not an evidence-based practice. I'm not saying that we need to tell our students to stop using it, but can we teach our students to first use an evidence-based practice as their base first? Another one is somatic experiences. So body-based trauma therapy focused on nervous system regulation, right? Fits polyvagal theory and mind-body trends. I would say that DBT also focuses on that without using this language. DBT talks about emotional regulation, and when you're dysregulated, your nervous system's jacked up. But somatic experiences is a new kind of approach where folks will talk about where do you find that in your body. It can maybe serve alongside an evidence-based practice, right? But again, using it as your sole foundation right now without the randomized control trials, we need to be mindful. And then energy psychology, tapping, feeling, things like Reiki, there's just not any evidence for it, right? There's not any evidence for it. I do think as a profession, we need to think about that. Can we do it? Can we answer this question? Can the core essence and intuitive wisdom of traditional counseling theories be truly harmonized with the empirical rigor and methodological demands of modern evidence-based practice? Yes, I think it can. First, we need to think about philosophical alignment, like traditional counseling values like wellness, prevention, and holistic growth naturally align with evidence-based practice. and folks will go ahead and agree with me on this, right? But I see amazing researchers that can speak to the evidence of certain things that don't know how to build a relationship. And it ain't gonna work without the relationship. So I do think our identity, focusing so strongly on that relationship, is important. Let's not let go of that. And let's bring that relationship into evidence based practice. Evidence based practice now includes therapeutic relationships, cultural context, common factors, allowing traditional concepts like empathy and meaning making to be empirically supported. So maybe you all, as you do research, can look at providing that evidence. And yes, too, is just my own thoughts, which is this, folks, that I do think that they can be harmonized. It requires us, though, to choose an evidence based model first. Okay? I've been thinking a lot about this. Is that the right thing to do, to teach all of our students all these theories? To start with psychodynamic, then let's learn about Adlerian, and then let's learn about existential, and let's learn about choice theory. Is that truly the best way to be teaching our students about theories? And then many times we're like, okay, now choose one and do it. Or should we as programs be coming around evidence based practice, right? Saying we're going to go ahead and teach maybe acceptance and commitment therapy, since it really does pull off of so many different approaches. And then from there, folks can bring in unique things. I want your thoughts on this. I want to hear what you think, because you all are going to be the leaders. You don't need to agree with me. You can disagree. That's what it means to be a scholar. But I want to hear from you. Thank you so much for listening, and look forward to reading in the discussion.